the
Yeah.
PPT.
So very good evening, all of you. So here we come again with another second half or second, you can say 1/3 of teaching and assessment of medical humanities. Now, before we begin with the assessment, just a brief, what you can call it as a brief recap of what we had done last time, because it's quite some time now. So just 2 or 3 slides of what is humanities and what are the attributes. Dr. Aditi, next one, please. Yeah. So these are various attributes of humanities. We will not go into definitions of humanities. And as you can see, humanities is like a umbrella. And in below that umbrella, we have got all these attributes: excellent communication, compassion, empathy, patience, emotional intelligence. I'm going anti-clockwise: effective team player, interpersonal skills, honesty, ethics, responsible nature, emotional stability, leadership skills, time management, etc. So humanities, basically, you can call it as a construct. It is not a single entity. It is made up of so many micro entities, and all these entities together make a person. And here, as we are talking about physicians, they make a physician humanistic physician. So next, Dr. Aditi. Next one, please. Yeah. So you can see here various, what to say, different shades of humanities have been shown. The first one, Dr. House, is sitting just near a patient, and he's a very good clinician. He has got immense clinical competence, but his attitude towards his patients is sometimes very bizarre. So which makes him a bit little unpopular among his patients. Then we have got second one. What he's telling is that's why you treat a disease. You win, you lose. Then Munna by MBBS, Anand. All these are classical examples where you can see different shades of a humanistic doctor or a humanistic physician. Next one, please. Now, the question was, last time we had discussed this also, whether humanities or attributes of humanities are innate or they can be learned. Next one, please. So, of course, many attributes of humanities are innate, right? Some of them are very good at soft skills. All these are called as soft skills: the compassion, empathy, communication skills, etc. Some of them are very good at communication skills. Some are very extroverts. They have got inbuilt or innate attributes of humanities, but it doesn't mean that those who don't have can't develop it. By research, it has been shown that if you practice with confidence and go on repeating certain what to say experiences, you can hone many attributes of humanities. So it is all about learning the previous things and learning the new ones. Next one, please. Now, this is Cartwell's taxonomy of affective domain. We have many times heard about Bloom's taxonomy. That Bloom's taxonomy is for cognitive domain. This is of affective domain. And whenever we talk about humanities, it is quite obvious that we are talking about the affective domain, attitude and communication domain, as per the NMC. And you can see here it is a triangle. The lowermost triangle, it is written receiving. And as you go further upwards, the deepness of the attributes of humanities in the students go on increasing. So initially the students might receive, then they will start responding, valuing, organizing it. And a time will come, if your efforts of teaching learning methods and assessment methods are appropriate, they might be able to reach the topmost part of the this taxonomy, which is the characterization of value set. Next one, please. And we want our students to actually, next one, please. We want our students to actually go into the shoes of the patients, which is called actually empathy. And up till now, yes, the student should be able to, previous one, should be able to internalize the feelings. So up till now, this was considered to be a hidden curriculum, as previously discussed, because nobody taught us humanities. And since nobody taught us humanities, we don't actually know what humanities is. And all these attributes like communication, empathy, compassion, we used to learn by role modeling, by looking at our seniors, professors, etc., etc. But there are various teaching methods also, or rather than the methods, we can call them as strategies to inculcate humanities among the students, like interactive lecture and brainstorming, role modeling, role plays, simulations, clinical scenarios, discussions, narrations, cinema education. Next one, please. Reflections, portfolios. मैम आप क्लिक करते जाइए, वो अपीयर होगा. Photographs, poems, yes. So previous slide was just about the various types of teaching learning methods which can be used, which we had discussed last time in detail. The basis, or you can say core of all these methods, was experiential learning, or rather is experiential learning. Means you allow the students to pass through various experiences with the hope that they will learn and they will try to reach up the topmost part of the affective domain, that triangle. So it's all about lifelong learning and self-directed learning. And this is a brief previous one. Yes. So this is what our team had developed, a few competencies related to medical humanities. Next one, madam. Yes. So, and we have compared it with the EdCom module which NMC has given. So these competencies are very much similar to a few in EdCom module. For example, MH1 1.1, already it has been given by EdCom to how to handle cadavers and so on. And later on, you can go through them. And these are medical humanities competencies 1.1, 1.2 from phase 1, phase 2, phase 3, and internship. So this you can use as a, what to call it, as a template for teaching various aspects of humanities. And if you think very carefully, many EdCom competencies are similar to these medical humanities competencies. Next one, please. So with these things in background, let us talk about the assessment of humanities. But believe me, the assessment of humanities is not as simple as shown in that video. Now, this is one matrix, competence matrix, which we had done last time also. So when the students come to us, the students are in the state of unconscious incompetence. They are not aware of their skill and they lack the competency also because they are not aware. Later on, as we go or as we take various learning methods or strategies on the students, gradually the students go into the stage of conscious incompetence. They become conscious that they don't know many things, but still they are incompetent because they don't have practice of doing it. So they are aware of the skill, but still they are not proficient. And as the teaching learning methods and if the assessment methods are appropriate, the students enter into the yellow square, which is the square of conscious competence. That means the students are conscious of their skills and attitudes, and they know also, they become competent also. Later on, with good assessment methods and with good teaching learning strategies, the students will reach in the state of unconscious competence. That is, they become competent and they become so competent that even subconsciously, they start performing certain skills and attitudes. So we want our students to reach up to the last square. At least they can reach up to the yellow square. And our team has proposed one more square also, the fifth square, which we will be talking about later on, for becoming more competent. So we are more bothered about assessment in the pink and the yellow square, conscious incompetence and conscious competence. Your assessment method should be very, very appropriate. Now let us try to understand what is the meaning of appropriate assessment methods. So in this discussion, I'll be talking about what is the meaning of assessment as far as medical humanities is concerned, why they are necessary, when should the students be assessed, and how should the students be assessed. Next one, please. Now, the first question is why to assess. Next one, please. We all know that the things which are not assessed, right, they are not usually possessed by the students. And there is a very famous sentence, assessment drives learning. Not only learning, assessment is a tail which drives the whole curriculum. It has been suggested, and after various researches also, it has been proved that assessment holds the key to learning also and to the whole curriculum also. So assessment should be very much robust. Only then learning will occur. And whatever is not assessed is not possessed. And why assessment should be used? To check how much learning has occurred, to provide value to your various curriculum, and of course, to provide feedback to the program evaluators. So you can assess and look at the outcome of the students, and then you can evaluate the whole program also. And we have this slide, just a few seconds I will take. As I've told before also, we as students, especially me, when I was a student, there was no concept of these humanities and soft skills. Nobody taught us and nobody assessed also. So when you are not assessed, usually you don't try to learn. अभी भी हमारे बच्चे, when we are sitting in our rooms or when we were seniors, the students and the juniors used to come to us कि मैडम टिक कर दो बुक के अंदर, जो भी आप टिक करोगे हम लोग वही पढ़ेंगे. It doesn't matter who has taught them, whether it has been taught or not, it doesn't matter at all. If they are assessed according to that, they will learn. And since we did not assess and did not teach our students, maybe they are not very proficient in this section of humanities. Next one, please. And that is why it is very much essential to assess. Now, the question is when to assess. Now, as far as humanities and soft skills are concerned, the assessment should be continuous. It should not be a cross-sectional assessment like a single snapshot activity, but it should be like a movie. Go on assessing at short intervals in multiple settings by multiple assessors. Next one, please. And at multiple times. And previous one. And at each point of assessment by multiple assessors, multiple settings, go on giving continuous feedback and go on mentoring the students. So that is basically the basis of formative assessment. So formative assessment plays a very important role as far as assessment of humanities is considered or concerned rather. And of course, it has to be followed by complete summative assessment also. So basically, when to assess mean, it should be not a single point, continuous, multiple assessors, multiple settings, multiple times. Whenever you use multiple words, it becomes more and more valid. The validity of the tool of assessment goes on increasing. Next one, please. So this is the diagram which you should remember. There should be, as you can see in the funnel, there is feed up, feedback, and feed forward. All the three together, it sets orientation for learning. And the wheel of assessment is based on formative assessment, reflections, self-assessment, and various tools of assessment. All this together, with the help of summative assessment, might make the students competent in various attributes of humanities. Next one, please. Now, the question is what to assess. Now, as I've told you in the beginning, humanities is not a single entity. It is basically a construct. I hope you understand the meaning of construct. Construct means something which is not very tangible, like honesty is a construct, right? Similarly, humanities also is a construct. You cannot exactly pinpoint or define it. It is made up of various individual attributes like communication skills, empathy, compassion, ethics, morality, etc., etc. So the question is what to assess, whether individual attributes or not. And the answer is yes, because you cannot assess humanities totally. You have to assess individual attributes. And if the physician or the student is competent in all the attributes, only then you can call him or her as a humanistic physician. And of course, whenever you assess any attribute, it should be context specific. And if you assess individual attributes, you are indirectly assessing the construct of humanities. So next one, please. So this is what is the various attributes you can see. The lowermost part, it is written, the blue one, clinical competence. Now, clinical competence actually forms the core of any physician. So clinical competence with the various attributes of humanity together forms a competent humanistic physician. So there are many physicians, we must be knowing that clinically they are very, very competent, but they lack humanistic qualities. So if that type of physician is there, no doubt he might be a good physician as far as his clinical knowledge is concerned, but we might not like to call him or her as a humanistic physician, which is actually required. So this humanistic physician, under that umbrella, we have got professionalism, communication skills, ethics, honesty, cultural sensitivity, etc. And whenever we label, usually the doctors don't do it, but whenever the patients label some doctor as a good doctor or not so good doctor, Basically, they are more focused on the humanistic attributes rather than the clinical competence. Clinical competence more or less might be similar in most of them, but what differentiates a good doctor from a not so good doctor from patient's point of view is this small soft skills, which are very much important. Next one, please. Now we have got one equation here, which is called as assessment notion. Now, according to this equation or assessment notion, humanistic physician is equal to clinical competence into communication skills, into professionalism, into ethics, into empathy, into honesty, into altruism, into trustworthiness, into cultural sensitivity, and into social awareness. So all these, what has been written, they are attributes of humanities. But if you think very carefully, it is not addition, it is multiplication. Now, what is the meaning of this formula? Multiplication means if any of the component or attribute of humanity is missing, everything will become zero. So for a competent humanistic physician, all these attributes should be present. It might be more or less, but nothing should be zero. So if the doctor is not empathetic or if he has got zero empathy, even if he has got other attributes, he will become zero. He will not become a humanistic physician. He might be having clinical competence also. And that is why it is very much essential to measure and assess as far as maximum attributes of humanities are concerned, to label that student or a physician as a humanistic physician. Next one, please. So this is our golden triangle. It might have come many times since all of you have completed your ACME also. The triangle of objectives, assessment, and teaching learning activities. This is called as alignment. There should be proper alignment between your objectives, your teaching learning activities, and your assessment. And as you can see, there are double arrows. It is not a single-sided or circle. Everything is connected to each other. So you might be having certain objectives. According to the verbs of the objectives, you have to frame your teaching learning methods. And according to the verb, you have to frame your assessment methods also. For example, next click, please. For example, if your objective is the student should be able to, previous one, the student should be able to demonstrate empathetic behavior. So here the word is demonstrate. So your teaching learning method would be something where the student would be able to learn how to demonstrate empathy. So it can be role plays, cinema education, many other methods also we have talked about. And more importantly, since we are talking about assessment today, your assessment should be aligned with the teaching learning activity as well as your objective. So if you want your student to demonstrate empathetic behavior, your assessment should be direct observation. So whenever the student is interacting with a patient or simulated whatever in the field, the assessor is supposed to directly observe the student. You may use any checklist and then go on giving the grades. That is the best way of assessing humanities as well as soft skills. Next one, please. Plus, at every stage, you have to give feedback also. So these are a few attributes of good assessment methods. We will not go into detail. You might be very much aware of it. Assessment methods should be valid, reliable, acceptable, feasible, and they should have good educational impact. Here also it is into. Assessment should be valid, multiplied by reliable, multiplied by acceptable, multiplied by feasible, multiplied by educational impact. So each of them can be more or less, but it can never be zero. So if validity is zero, other things don't matter. Similarly, feasibility, acceptability also. So again, this alone might take 1 hour also if we try to explain everything as far as general assessment is concerned. But this applies to the assessment tools for humanities also. Next one, please. Now, how to assess? Now, as far as humanities and soft skills are concerned, more stress is given to subjective expert judgment. Now, many of us, and especially our seniors, might not be very happy with the subjective assessment. We prefer usually objective assessment methods so that there is reliability increases. But if we talk about reliability, even subjectivity can be made reliable by using multiple assessors, multiple occasions, multiple times, multiple settings. All these might increase the objectivity within the subjectivity. And subjective assessment methods are also as good as objective assessment methods. So whatever assessment method or tool we select for humanities, more stress should be laid on subjective assessment. Based on observation, it should be a part of ongoing assessment. It should be more of formative and less of summative. So give more opportunities for the students to get assessed. And at each assessment station, you go on giving feedback, the students go on improving. And if you do this multiple times, their learning goes on increasing. Next one, please. So we have got one wheel. Okay, so before that, this is Miller's pyramid, very famous pyramid. And as you can see, lowermost is knows, then knows how, shows how, and does. Just a revision on in one line. Lower two steps, that is knows and knows how, they correspond to the cognitive domain. And topmost two, shows how and does, they correspond to the actual behavior of the students or the person who is being assessed. And we are assuming that when the student is going each and every step above, he has become competent in the lower step. So if he is able to show something, that we are assuming that he knows and knows how also. That is our assumption. But it is always said that it is better to test the knows how also when you are testing shows how, so that it acts as a sort of a multi-source feedback, so that we come to know that he has got knowledge also, plus he has learned attitude also, and plus he is expert in the behavior also. And again, I will like to repeat here the topmost part, that is the purple one, does. That is more for postgraduate students. And for undergraduate students also, certain competencies now NMC has kept in the does level. Does level means when the student is actually doing something on a patient, not on simulated patient, but real patient. So your tools of assessment should be based and should be able to cater to each and every level of Miller's pyramid. We will go into detail also of this. Next one, please. So these are a few characteristic features of assessment of humanities. As you can see, topmost, it is written programmatic. And since all of us, or all of you rather, have undergone one full, 15 days of online this month of programmatic assessment, you must be knowing this programmatic assessment are single points, multiple points in which small assessment tools are used, and some summation of all these points. The judgment of all these points, you have to summate it and then use it for your final summative assessment. So that is programmatic assessment. Multiple small low stakes examinations are called as programmatic assessment data points, which are combined together to come to a judgment whether the student is competent or not. So this plays a, or rather I would say, programmatic assessment is made for soft skills, rather I would say, because the other hard skills you can judge objectively, but soft skills are just better subjectively and using small low stakes examinations. So mainly they should be subjective, catering to the affective and communication domain based on direct observation. They should be continuous and formative. You should give ample feedback opportunities at every data point of programmatic assessment. Use multiple assessors, multiple times, multiple settings to increase the validity and reliability. And the assessment method should be continuous and longitudinal. So these are a few, characteristics of assessment methods. And again, here we come to the Miller's pyramid. So if you want to test the nose level or just simple knowledge level of the students, you can go for MCQs, essay questions, short answer questions. Then still higher up, if you want to test the knows how, then you can go for portfolios, case-based discussions, shows how level. You can go for PMAX, OSCE. This mini CX should be actually on the topmost part, that is the does level. Mini CX, then multi-source feedback, critical incident reports, all these are for the does level. So usually for soft skills, we want our student to, at least UG students should be able to reach at the level of shows, and PG students should be able to reach at the level of does. And at each level, you go on giving feedback opportunities, monitor continuously, lead them to summative assessment and continuous formative assessment. So that is how the humanities are being or should be assessed. Next one, please. Now, these are a few tools of assessment of humanities. On the right side, we have got this Miller's pyramid. Already I've explained that. On the left side, you can see controlled testing environment. Now, this controlled testing environment caters to the shows level of Miller's pyramid, which we want in our UG level. So control means you don't allow the students to actually treat the patient independently. So there should be some faculty who is observing whenever they are demonstrating or doing something. That is called as controlled testing environment. So typically OSCE, that is objective structured clinical examination, as we know, the rotations are there and there is always one observer, because you cannot leave the students along with the patients. Then you can use standardized patients, not the real patients, but simulated and standardized patients, simulation-based assessment, role play, cinema education, etc., etc. These can be used as teaching learning strategies, and sometimes these role plays. You can, whenever the student is performing role play, you can use a checklist also, and you can assess also at the same time. So these tools, OSCE, standardized patients, and simulation-based assessment, they are for shows level controlled testing environment. But there are certain, competencies in UG. And for PG, all the competencies, they should be tested in real clinical settings, when actually the student or the PG student is actually interacting with the patient. So we can use mini clinical examination as a tool for assessment, multi-source feedback, community-based assessment, etc., etc. Next one, please. So this is a typical OSCE. Here you are assessing only one component at one point. And the only thing is, longitudinally, you cannot assess the patient because each component is a snapshot component. But still, if you can make it like a movie, then maybe you may be able to assess all the attributes of humanity. But the only thing is here, OSCE is totally controlled. You cannot leave the student alone with the patient to interact. There should be an observer because the student have not reached up to that level of competency. So that is OSCE. Next one. So basically, you just ask the student to interact with the patient, and you take a checklist, keep the checklist with you, and go on taking it and go on giving feedback also. Now, this assessment toolbox is for DUS level, that is the workplace-based assessment. And you can see various tools have been written here. For documentation of work, we have got logbook. Then for direct observation, mini clinical examination, DOPS. Then for discussion on individual cases, we have got case-based learning. We have got MPAT. These are short forms. You can see the long forms also have been written here. For assessment of knowledge and skills, you can use OSCE and MCQs. Usually OSCE MCQ is not included in WPBA. It is more for the shows level. And for record and feedback, we have got portfolios. So next one, please. Now there is one form which is called as mini clinical evaluation exercise. Very frequently nowadays, many institutions have started using it for even for undergraduate assessment methods, and it is a very good form. What you can say, a tool for assessing the soft skills, including various attributes of humanities. And it can be used as in outpatient, inpatient, emergency room, even in skills lab. And I don't know whether we have seen or not, but you can download from Google, and it has got various components, and each component you just have to grade it. You just have to tick, and then finally you add it, and how to judge the scoring, that also has been given in the form. So basically, by this form, you can assess the interviewing capacity or the communication capacity of the students, physical examination, professionalism, clinical judgment, counseling, etc. All these attributes can be judged. Next one, please. Next, yes, next slide. Previous one. Now this shows the assessment tool according to the domains. So already we have done for cognitive domain, MCQ, SCQ, MQ, etc., etc. So we have already done it. Just a minute. Now before we go further, the fourth one. is for psychomotor affective domain, OSCE, mini clinical examination, multi-source feedback, clinical incident report. After that, we have got for professionalism, we have got one scale, which is called as PMEX, professionalism mini examination. It is similar to mini clinical examination, but this one tests professionalism more. Then for empathy, we have got a scale which is called as Jefferson scale, very famous scale. For communication skills, especially, we have got Kalamazoo's communication checklist. For altruism, we have got a self-assessment psychometric scale, which is called as altruism scale for adults. And for cultural diversity or testing the cultural competence, we have got cultural diversity self-assessment instrument. So lower 4 or 5 ones, they are new ones, and even you people can use it in your new projects, because these have not been in India. These have not been tested frequently. So if you are trying to apply for FAMER fellowship or any other FAMER or any other fellowship, these type of projects are new projects, and they carry more weightage compared to other projects which have been done many times. Next one, please. Next one. So these are special tools already which I have mentioned. This is Jefferson scale. Previous one. Next one. Yes, Jefferson scale. Next one. So it is a validated scale for especially for empathy. And you can see various components. There are 10 components are there. And finally, you have to give the score. It is based on the Likert scale. You can see on the top, it is written 1 to 7. And even the how to judge from the score, that also is given. And it is freely available. And many have started using this for checking empathy. So you can take a pre-test, then ask the students to undergo any immersive activity, and then you can take a post-test also. Next one, please. In our FAMER, there was one madam, Kirti ma'am. She had used this Jefferson scale for implementation of empathy module in the undergraduate medical curriculum. This is PMEX, Professionalism Meaning Evaluation Exercise. So this is also based on a Likert scale, and there are various attributes, and you can go on scoring, and finally you will have a global rating also. Next one, please. This is Kalamazoo scale, especially for communication skills. It also has got a scoring similar to Likert scale. Next one, please. This has been suggested by NMC or undergraduate medical students. In compound it is there. Next one, madam. Is it not going further? Yes. Then multi-source feedback. This is very important as far as humanities is concerned, because you cannot judge a person based on single assessment method. So patient survey, peer assessment, faculty feedback, nursing staff feedback, these can be used for a single student, and you can judge based on the assessment scores from all these. Just give one more click, ma'am. Just a single click. So this is how a student or a physician can be judged. Taking feedback, Aditi?
Yes, ma'am.
Then we have got community-based assessment methods, which actually assess the team building, leadership. Next one, please. The tools will remain the same, direct observation only. You can go on clicking, madam. Portfolios. Portfolios are also very important for keeping the records, learning portfolios, assessment portfolios. And why portfolios are very important? Because you can record the reflections or reflective writing. And from reflective writing, we can judge how much the student has learned, especially the soft skills and various attributes of humanities. We will see later on how it can be used. Next one, please. Nowadays, we have got e-portfolio also. Reflections, we all know now what are reflections. Now, these are very important. They are hybrid tools, actually. They can be used for learning also, and they can be used for assessment also. So after giving any immersive experience to the student, for example, role play, cinema education, poems, narratives, etc., then you can ask the students to reflect. Now, reflections can be very simple also, and they can be deep also. Usually by reflection, we are asking the students to revisit that learning experience and comment on various aspects of that learning experience. And there are various models also. You must be knowing that. So basically it involves describing, interpreting, evaluating, and planning. So the second, third stage and fourth stage are very important. Interpretation, evaluation. These two include critical thinking. And by critical thinking, learning occurs. So that is how to learn from reflections. And these reflections can be assessed also with the help of a checklist and rubrics. Next one, please. Next one. This we have already done. And when the student reaches the stage of unconscious competence, by using reflections appropriately and with a deeper meaning, you can guide the students into the stage of reflective competence. And you can make them more and more expert. So our one book is coming. In that book, we will have one full chapter on this reflective competence. So next one, please. At that time, maybe we will take another session. Next one, please. Yes. So basically, rubric. Now, maybe the rubric might be new for you, but rubrics have been used quite a lot in Western countries for assessment of reflections. And reflection is considered to be a very good assessment method for testing the soft skills and various attributes of humanities. So when the student is undergoing role play or communication, ask him to reflect, collect the reflection, and try to grade the reflection. Now, we all know that grading the reflection is not very easy. There is a lot of subjectivity involved. Some might give A grade, some might give B grade, and there are no basic criteria also for it. No, universal criteria. So in that, rubrics plays a very important role. So though we are telling or we are saying that make assessment of humanities subjective, we can objectify that subjectivity also in the form of rubrics. So rubrics basically is nothing else but a table which consists of task description, criteria, level of performance, and descriptors. Next one, please. This is a typical rubric. And as you can see, it has got various squares. On the top, it is the task description. Task description means competency. Then scale maybe or Likert scale or another scale you can use. Here they have written poor, good, and excellent. And on extreme left, there are various criteria. Criteria means, in the next one, there will be example also of the criteria. Next one, please. These can be assessment criteria. So depending upon what we are trying to assess, right? Whether the student has given proper description or not, whether they've used any model, they have given attention to emotions or not, whether there is clarity, whether they have evaluated and synthesized something new. All these can be used as your assessment criteria. Next one. This is a typical rubric. So if the task is performance of a specific clinical competency, for example, if you're talking of humanities, the student should be able to demonstrate empathy and compassion. If that is a task, then you can frame your criteria. And you can see on the left side, various criteria have been written: medical knowledge, professionalism, clinical examination. And on the right side, each square, there are various, grades are there, 1, 2, and 3. And you can see here in each table, there are descriptors. So this grading is also not random, right? It is not, no doubt there is subjectivity involved, but subjectivity also has got a clue. So if this is written, then you will give grade 1. If this is written, grade 2, and if this is written, grade 3. And like this, you just have to put a number depending upon these descriptors. Next one, please. Grading of rubric or reflections can also be in this way. 1, 2, 3, 4, depending upon your subject experts, you can give the gradings. And descriptors, again, here are very important. Next one, please. This is again a rubric, a standard rubric. So this rubric actually is also a very new thing in India. So you can take up projects regarding that also. Even if at your own institute, if you are taking up a new project proposal, you can use rubrics, you can use various types of skills, Jefferson skills, which will give a novelty to your project. So here you can see the criteria are written, this scaling is there, and you can see the descriptors are very much specified. So you just go on ticking in each particular square if that particular descriptor is getting taken care of by the student. Next one, please. And in the end, you can, next one, please. In the end, you can just sum all the scores of the rubrics. So that was all about rubrics and how to use rubrics for assessment of reflections, which can be used for assessment of humanities. So the summary of my talk is we have come to almost the end of the talk. The summary is the humanities has to be assessed indirectly via its attributes. You cannot judge humanities as a single entity. The assessment has to be longitudinal, developmental. Formative assessment would play a very important role, and feedback, they are two major components. You go on giving feedback and trying to make the student more and more competent. And core elements of assessment of this type, especially humanities, is direct observation and subjective assessment. Next one, please. So most of the last session and today's session I have taken from this book, which is by our team, Humanities in Medical Education. It is a multi-author book. Many authors are there. And especially for you people, if you are in medical education unit, you can get hold of this book. And almost all the sessions related to EdCom are there. So if you've got to take a session on reflection or humanities or professionalism, full chapters are there. It can act as a very good resource material or resource for all of you. Next one, please. So these are a few references which I had used. If you have got anything to share, you can share. Next one, please. Dr. Aditi can stop the recording now. It's time for a halo for in Gujarat. The Garba lovers are calling us.